Welcome to the AWIP podcast. I'm your host, Ray Smith. Here at AWIP, we focus on investigations and all things animal welfare related. We're bringing you in depth conversations each week with animal welfare professionals around the globe, so be sure to find us on LinkedIn, YouTube, and Spotify. To learn more about AWIP and our mission, check us out at awip.org.uk. Or I'm super happy about our next guest that we have on today. Jacob's not here, so once again, I'm flying solo, but that's fine. Our guest is a licensed veterinary technologist. She's actually licensed in several different states, and so I'd like to introduce Renay Peters. Renay, how are you?
I'm doing great, Ray. How are you today?
I'm good. I'm happy that you're here. Thanks for joining us. You are our first tech on the show, so that's exciting. Before we get into talking about all things in the tech world, Renay, can you kind of go through your journey in animal welfare and what led you to where you are today?
Absolutely. And thank you again for having me today. I'm very excited to be here. So, my journey is probably a little non traditional. I mean, of course, when you get involved with animals, everybody has, I've always loved animals my whole entire life, had them growing up. So, that's kind of universal. But I actually did not even work in the veterinary field at all. I was a non-traditional student. I was working in sports media and decided, hey, kind of burned out. What is my real passion? At that time, a very high profile football player and dogfighting case had happened. And having an interest in sports and being a sports related person, and then also having that interest in animal welfare and in seeing and being exposed to dogfighting in this case, made me question what I wanted to do. So at that point in time, I said, you know what? Didn't know there was a field called veterinary forensics. Learned to Miss Dr. Melinda Merck and followed the case and said, you know what? I want to do this. So if I'm going to do it, I'm going to do it from the beginning and do it the right way in my mind. So I enrolled and went back to school, received my AS in veterinary technology in 2015, got my original credentials to become a RVT in 2016, finished my bachelor's at St. Petersburg College as well in technology in 2020. And then the ultimate end goal was to apply for your University of Florida's master's program in veterinary forensic science. And I graduated in 2023 with my master's in veterinary forensic science. For me, it was a long journey, about 12 years. My goal was to graduate from grad school before I turned 50. I'm giving away my age now, but 3 weeks prior to turning 50, I graduated. It was something that I truly wanted to do the right way. Again, in my book, and I wanted to prepare myself to have as much education, experience, and knowledge so that when I came to this point in my career, I would have those credentials, I would have that education, I would have that to back up what I wanted to do, because I'm sure we'll get into it later. I'm not DVM or law enforcement. I'm not a prosecutor. So I'm in a position that is kind of still new. So sorry, that was a very long answer to you.
No, it's your show, so it's fine. I find that really inspiring too, like for several reasons, because you went back to college when you were older, right? You weren't right out of high school. So you're an example that people can do it. And I think also what is inspirational is that you found your real passion later. And there's some ways that I can really empathize with you. And there's some ways that's very different from my path, because I kind of always knew what I wanted to do and just did it straight off the bat. But I really love talking to people when they're like, later, however, it doesn't matter how later. They're like, this is what I want to do. So I find it really inspiring, your path and how you went about that. But there are so many different paths in the veterinary field. And so we hear about technologists, technicians, veterinary assistants, registered veterinary techs, licensed veterinary techs. Okay, Renay, what is the difference between all of these? Help us break this down.
Well, with being a vet tech or a veterinary technician or technologist, there is a gamut. In some states, you can work in a veterinary hospital or clinic and not have gone to school, because each state is different. Now, whether they recognize you, what you can do, it does vary. And that's why we have the different titles. So to kind of make this a little bit easier, and this may ruffle some feathers, but it is If you go to the AVMA, this is how it's explained.
Okay.
If you have no prior education, meaning college or exams that you take, you are typically considered a veterinary assistant. That means that you can work in the hospital, but your role, you're not licensed, credentialed in any way. You are basically learning on the job skills, which again, there's nothing wrong with that. But
Mhm.
that again varies from clinic to clinic, what you know, what you embrace, what you don't want to embrace. How much do you move forward and progress with the field, or do you stay stagnant to what was always done? So the next level would be someone that goes to school for 2 years. They have gone to an AV, so that's the American Veterinary Medical Association accredited school. They've completed 2 years of schooling, and then they have the transcripts and information to go and take their VTNE, which is the national boards. It's about 3 to 4 hours typically, and it covers 7 different species. And once you pass that, depending on the state you're in, you can consider yourself a licensed veterinary technician, a certified veterinary technician, or a registered veterinary technician. They are all the same, but have a different title because each state, like in Texas, I'm a LVT. In Florida, I'm a CVT. And in California, I'm an RVT. So those vary. Now you can take that a step further. And if you continue on and you receive your bachelor's and you have already taken your VTNE, you can consider yourself a technologist because at that time you have your 4 years of school and that you have passed your VTNE. The next step would be one other specialized licensing, which I'm currently looking at and pursuing mine in behavior, animal behavior, but that would be a VTS, and that's a veterinary technician specialty. They have those in all different aspects: emergency and critical care, dentistry, rehab. There's different academies. Now, that is taking another exam, each vary in length and responsibility. You also have to have letter of recommendation for your applications to be submitted and accepted to even sit for the exam. Most of the academies want 4,000 or more hours. You have I think behavior is like 20 or 30 case reports that you have to do. So this is something that you can't explore until at least 5 years as a licensed, registered, or certified veterinary technician.
Yeah, 4,000 hours?
Yeah, of hands-on videos, skills, you have to be signed off. So it is extensive. So any of your VTSs out there, kudos, because it's not something easy. It's very time consuming, but it takes your knowledge up and you are specialized in that field. So mine would be behavior, to where I could work with a boarded certified diplomat of behavior. I could do, help with management of issues and things like that. The key though is utilizing each level of technician to its fullest. And that right there, we have a problem with in our field. Not utilizing your credential techs to the fullest, not utilizing your VTSs, and then getting title protection so that, the Abby Sue that just graduated from high school is a vet tech, but then you have someone like myself that has, 4 years of school and a master's, and the average person in taking their pet to the vet doesn't understand the difference between that.
Yeah,
So
I didn't understand.
it's kind of a big smorgasbord of things. We're trying to move forward to have more universal titles, protection, utilization, and pay. But it's taking a little while. But
It is.
it's trying to get the mainstream population to understand that I don't play with kittens and puppies all day. There is a vast amount of areas and facets of veterinary medicine that we as technicians and technologists can work in, but you don't really get exposed to that unless you get a little bit more education, networking. Most people assume you work in a clinic, you can work in emergency, and maybe a zoo. And that's really all they think is there for us. And there's so much more with animal welfare, too.
And I really like that you touched on utilizing technicians, and just for the purpose of this, that's what I'm going to say is technicians, just all of you guys, okay? Utilizing technicians to their fullest potential, because I don't think that in general we do that very well.
No, we
And
don't.
especially with the veterinary shortage that we have now and that we're going to be in for a long time, it's so important to really rely on you guys and use you guys like to help whichever kind of business that you're working with. And some states have been doing this, right? Some
Mhm.
states have started to expand state law to
Mhm.
allow technicians to do more things. There are some who are opposed. What's interesting to me is that the AVMA has been opposed to this concept of utilizing and giving technicians more power, more responsibility and such, because then that liability falls back on whoever the attending vet is in
Mhm.
their license. Can you talk to me a little bit about the progression that you've seen? How do you think that we can better utilize our techs regardless of whatever kind of licensing and training that they've had?
Oh, I think, having worked in three different states, California, Texas, and Florida, um, I've seen a very big difference. Now, obviously, every clinic and style of clinic is very different. I've worked in specialty, I've worked in general practice, I've worked in shelter medicine. And I think it has been my experience that the most progressive thinking and utilization has been in California. I know that they are a little bit more stringent on even title protection and what we can refer to ourselves as. And I'm not going to say it's perfect, but just my experience, I felt like I was utilized more and I was still very green, just coming out of school. I think that there has to be pride, a little bit of pride too. I can't say, and I want to put it out there for all the non-credential techs. I'm not putting you down. On the job trained is, and I've worked and learned from some amazing on the job trained tech assistants. But there's got to be a point where those that are amazing at what they've been doing have to kind of get, I hate to say, but a kick in the butt to get those credentials so that we make the profession better. As long as I feel like, as long as we still have these two sides trying to fight each other on the job train, credential train, we're never going to get to the point where we're utilized because you're always going to be pulled this way. Vets have to start stepping up, and when they hire people that are credentialed, utilize them. If the vet doesn't feel that they have the skills quite yet, work with them, get them confident. But that's another problem. You go in, and again, I've been here 30 years, I don't have my credentials. You just graduated school 2 years ago, you're coming in, you want more pay, but I've been here. Let's stop doing this and have those hospital managers and your vets come down and say, "Okay, guys, we need to work together. So let's get you that's been here 30 years. Let's look at how we can help you get that education, tuition reimbursement, things like that. Let's motivate you to go to school. Okay, you're new. Yes, you need to get this on the job train, get some more skills behind you, get some more confidence. Let's get this person to work with you. I'm going to work with you, and let's work together for the greater good of the patient and the client. We don't have that yet. And I'm pointing fingers at all of us because I don't feel like
Mhm.
we have that camaraderie. I think you have a lot of techs that feel like they're burned out, they're not getting paid, they're not getting utilized. If you have a VTS that works for you, utilize that knowledge because that person has worked hard. And if they can show by example, they know what they're doing, they know what they're talking about, and they can help the practice, utilize that. And I'm in a lot of Facebook groups for technicians, and it's just always and it's like, I don't know if it's because I'm a little older, but I want to step back and say, guys, we've got to work together. We need to work together and come unified so that our management and our doctors will know, hey, they're not going to put up with this. They've come together, then we need to come together. So I think it's a universal issue. I do feel like it's getting a little better. But again,
Mhm.
having worked in three different states where, I'm in Texas now and title protection is kind of, they're working towards it. The societies are working, but it's kind of a joke. And that's the other thing, you want us to spend money to be part of these associations and help you grow. But what are you doing for us? But how are you advocating for us in these meetings? I mean, I've been in meetings here in Texas where I've heard a DVM come out and say, I will not hire an LVT. I don't need to. They don't need to go to school. Why? Wow.
Well, I mean, it's kind of like you said, everybody has their strengths, whether you have gone to college and gotten your certifications or you haven't. And it really shouldn't be about pitting each other against each other. We all have strengths that we can help each other with. And this isn't just, in the tech world, this goes for any job. really. We all have strengths in the things that we have either learned on the job or in school, and so it's important. And I think that you're right about that. It's really trying to get everybody on board and realize that like this is our end goal and this is how we get there, and so we all need to just get on the same boat and get there together. Renee, so I'm wondering when you are in school for whichever one of these degrees that you're going for, to what extent do they talk and train people about cruelty and neglect cases? And I'm also wondering also if you're taught anything about the link.
That's a great question. It's those are some of the things that a few of the podcasts I've been able to do, or Zoom meetings with like St. Petersburg College, their veterinary technician society. That's one of the questions that I asked. I wanted to ask them and say, hey, how much do you feel you know about cruelty? Have you ever heard of the link? And do you know what your reporting laws are? And as I stated earlier, I went through school in 2015 is when I kind of started hitting the technician. We do get exposed, or at least, let me clarify, disclaimer, the program I went through, St. Petersburg, and I also did distant learning for both of my degrees there. So you do get exposure at that program at that time to, I would say, more or less simple neglect. It's very, very small, and it's very clinical, if you will. Dog comes in, simple neglect because maybe the owner doesn't know better, so let's educate the owner. But to be perfectly honest, I'm thinking back and I'm going to say very little and nothing about the link. Now, obviously, we study because of being a behavior, and I went the behavior route, and we have amazing behavior professor at SBC. I took electives in that. So we did look at like the human animal bond and explore that and how that can be compromised a little bit by improper training or not using positive methods, things like that. Went through animal assisted therapies, things like that. But to sit down now that I know what I know, having gone through program at University of Florida and getting my master's, there needs to be more. Not only for veterinarians, but I feel like veterinary technicians really need to touch on ethics, did touch on reporting a little bit, but not to the extreme of, I think there needs to be more. And I think we need to progress and start including that human element in there as well. And that a correlation between animal abuse and interpersonal violence, because it doesn't just happen to animals and it doesn't just happen to humans. It's a public health, and and there's a lot of misconceptions. Again, I see it in these posts. Dog came in, I have some unsure feelings, I don't know, but the person brought it to the general practice, so there's nothing we can do. There's still a misconception that abuse only happens in the basement, and if anything, you may see it in emergency medicine. It doesn't happen in your daily practice, and that, as we both have probably seen and know, is very untrue. The other misconception is, people feel like they have to prove guilt. That's the prosecution. Yep. If you suspect something, it's not right, you should report. And good Sammys not having protection. So I don't think that it's touched on enough. I think that we do need to do better. I know that some of the vet programs are starting to implement it, but we need to, again, utilize the technician, get this information out there. We have too many programs out there for technicians now on the AA level and our AS level and a BAS level that we're not including this. I feel like it could be put in ethics. It could be a class on its own. And people need to realize that there's a lot to it. And if it's happening to an animal, it potentially could be happening in that household. And we don't know enough, and we're not utilizing our resources around us enough. Because again, lonely old tech. I'm not the vet. Do I really? And going back to utilization rate, like you said, I have this information. Say I was working in clinic. I don't know if my vets, and it's not a dig at vets, I don't know if they would listen to me. If I came and said, hey, I'm looking at the chart, I see this red flag, this woman has a black eye that brought her dog in, the dog's characteristics and behavior is this, the chart has a puppy that came in a year ago with the same thing, I have concerns. Are they going to listen to me?
Right. And they're just like every state that you mentioned, the reporting requirements are different. And as far as I know, and if there's anybody out there who can correct me, as far as I know, those reporting requirements really only speak to veterinarians, and technicians are kind of just left out of it.
Mhm.
Some vets are required to report cruelty when they see it. And one of the things that I want to mention too is that, and I have worked with a myriad of vets for the last decade. At different clinics around the country. And there is this myth or this belief with some vets that if you report these things, you're going to lose
Mhm.
clients.
Mhm.
I recently had the ASPCA come out and do a training at my shelter a couple years ago, and their veterinarians had done their own kind of polling and with vets all around the country who, and they were like, this is just a myth. In fact,
Mhm.
for the average person, I'm taking my dog in and I found out that my vet is reporting cruelty to their local animal control. I'm going to be more likely to
Mhm.
go there because I'm like, you're
Mhm.
doing your job, you care, you took an oath and you're upholding it. I want to give you my business. You're doing this for the animals. And
Right.
so, like, I don't really understand why that myth is so prevalent out there. I can kind of understand it from a
Mhm.
business standpoint, but it's being debunked, I don't think, fast enough.
Mhm.
But what are your thoughts on that?
I hear that one a lot too. And I think from being in the business, I think some of that stems from, again, not being able to progress and see that this is a real thing, maybe a little bit of denial. Oh, you're all nurturers. We go into this because we love helping animals. So it's like, do you really want to believe people can do some of these things that we know that they do? Another thing, I think the field has a stigma. Veterinary medicine has a stigma that we money gouge, that we're in it for the money, we're not in it to help. And as great as social media and social platforms are, they've really opened up a door for harassment and ugliness to the veterinary profession. uh, it takes 2 seconds for someone to get mad because you're a good Sammy, you bring a dog in. We triage what we can, but we also have to pay bills and
Right.
take care of our staff. And then that person gets mad and goes and jumps on a keyboard. I think it stems from a lot of things, but I think we have to get past that and we just have to be like, no, we have to do this. But I think we've been beat up in the field a little bit too. And I don't think people really truly understand every aspect of what we do. I mean, even when you say things like taking a dog to treatment, we're doing something now. I'm fear free proponent, so I'm very transparent, and I feel like things can be done. But
Mhm.
automatically, people assume you're doing something bad and you're hurting their pet. So I think that we have to almost get past these hangups and just say,
Mhm.
let's go for it and let's move forward and get people to understand that we're advocates. We took an
Mhm.
oath and we can't do our job to the fullest if we get these hangups to where, we don't think people are coming back. If you're a great vet and you have a great hospital, you're transparent, you're doing everything you can, you're not going to make everybody happy, but you're going to get the people to follow you because they know you have ethics, they know you have compassion and empathy, and you're making the tough decisions when some people would just turn a blind eye and not care.
I've worked with so many great techs too. And I agree with you. I don't feel like they get as much exposure or continuing education
Mhm.
or training about animal cruelty and neglect. And I can think of, in my experience, that the technicians have been more often the people who are
Mhm.
reporting these things to me as animal protection officer, that they're concerned about. They're concerned about the animal. Either they leave AMA or they come in with some kind of horrific injury or illness or
Mhm.
something along those lines, and they're concerned. And I've asked, so I'll start these investigations, and some of these texts are just fantastic. The photos they take and the questions they ask and the documentation recognizing signs of cruelty and neglect have been really, really, really great. I can remember a very specific case, and I won't go into a whole bunch of detail because this is your shot, this is your show. But this puppy had come in, and it was the absolute worst embedded collar case I had ever seen, and I had handled several dozen, but it was the absolute worst one. And the photos that these techs took were so fantastic that 2 years down the line when state charges had been issued or ready to go to court, and I'm sitting there working with the prosecutor talking about what we're going to present in court, and I'm like, these photos, A, C, E, these were all taken by the techs. They are fantastic and you need to use them. Just the amount of detail, almost like I feel like maybe they knew about forensic photography and the importance of having far away shot, mid shot, and then a close shot. And it was just, I'm like looking at this and I'm like, I don't normally get these this great, and it was fantastic. For me, I've always said, a well trained officer, a well trained tech is invaluable, absolutely invaluable.
Definitely. And you just touched on something right there that makes total sense, because having graduated, while I'm not full time in the field quite yet, working full time, I still want to bring awareness. I still want to network. I still want to keep learning myself. But those photos and what you said, that you were able to take those photos and take them over to prosecution, that's part of the problem right now, that scenes and documentation is not done to where it can be utilized by prosecution or potentially go to court. And we don't know what happens today. Like you said, I think that was a couple of years down the road that it, so
Yeah, 2 years.
yeah, so you don't know if you don't have this training. As we both know, documentation is, the gold standard. If you don't have written, visual photos, and if those photos aren't taken right and they show what needs to be done, it's going to be tossed out. They can't take it. So that right there, I mean, some of the people that I've been talking to in the last couple of months, not really consulting for them, but just trying to learn and kind of give my thoughts on what I see, the photos, they'll send me photos and things like this. That's been part of the problem. I look at it and I'm like, there's nothing in this.
Mm-hmm.
You can't see. You start asking questions about, were there any insects at the scene?
Mm-hmm.
Huh? And it's not like everyone should have to go through and have a master's degree in this. I get that. But
Right.
there are basic skill sets, and that warms my heart to know that technicians made such great photos. And again, but that's something, there's no reason why we can't teach that,
Right.
or
Just
at
like your
least.
ethics class, right?
Hmm.
Everybody has to take their ethics class. There should be a class on cruelty, and it's taught. Maybe it should be taught by a couple of different. I don't want to say professors, but like maybe have like an animal control officer do part of it. Maybe have a prosecutor teach part of it, and talk about how we are all ingrained when it comes to cruelty and neglect cases. So when you're in the beginning stages, you're learning, you're going to school, and you're being trained on all of this stuff, you're getting that exposure to, this is how I report. This is what I should look for.
Right.
These are the people I need to work with. And it's not like you have to be a full expert. I'm not saying that you need to specialize in it. I mean, maybe you could maybe there would be a specialty for that kind of thing. I don't know. But just having some basic exposure, because it is going to happen to you when you come
Hmm.
out and you are a tech. You are going to see some cruelty or neglect to whichever degree at some
Right.
point. We should be setting techs up, regardless of whatever they're specializing in. They should be set up for success for when this happens.
Right. And building those bridges, building those relationships. Just sitting here and listening, that's a great idea. If you bring prosecution in, ACO in, a humane law officer, a technician, a vet, a forensic vet, you have these people come in. Guess what? At that level of education, you're starting to get into people's mind. Build these relationships with your ACO, build these relationships with your pathologists, build these relationships with your domestic violence shelters. And you're not waiting till you're already in the field. You're getting this in people's mind, ingrained in their learning levels, so that it's
Mhm.
not anything out of the ordinary when they go into practice,
Yeah.
because it's been taught. And I think that would be a wonderful way to get different viewpoints, because I know even sometimes it's hard for you guys. I mean, I've worked with so many ACOs and humane law officers in San Diego, and they're amazing people. But you guys get your glorified dog catcher, what have told me, and you do
We're
way
trying
more.
to change that name.
And I hate that, because I'm like, they do so much more, but you don't take the time to get to know them and talk to them and understand their job. Because, even here, when things go wrong, like where I live is a very small town. sheriff's office handles complaints. The small town over or the bigger town over has two animal control officers. People
Mm,
don't understand jurisdiction either. And that's a big problem. Well, they're not doing their job. Well, they're not our jurisdiction.
yeah.
So, again, being able to work with people to understand what you do and how your hands are tied. Well, that dog doesn't have shelter. It has an igloo. It's not utilizing the igloo. It's not tethered. So if you have a problem, look at the terminology of the laws. Help change the verbiage, the old usage, and the vagueness of these laws. Don't condemn your ACOs and those people, because I don't think people, and I think some of the people in the veterinary world don't understand what you guys do. They don't want to build that relation with you because they're like, oh, they did it. No, you got to work together,
Yeah.
and that's hard. But I think if we were to have classes like that and
Mhm.
have people like yourself that are knowledgeable, most ACOs know way more about reporting laws and the abuse laws than most of the techs I know, because
But
it's what you do.
well, yeah. I mean, yeah, I mean, interpreting and enforcing law, you
Mm-hmm.
have to know the law to enforce it. But from my perspective, with all of these techs and that I work with, at my shelter, at other clinics, at hospitals, you name it. I just think that relationship is so, so important. There are some that I work with who like they know I can think of several different clinics in my jurisdiction that they're like, okay, we're going to report this. Here's my name, this is what happened, I've got the full report ready for you, here's the radiographs, here's the photos we've taken, and we did all of this because their arm is bandaged up, so you're not going to be able to take photos right away, so we did it all for you. Here's the pictures pre-shave and post-shave.
Oh.
And like there are some techs that I work with who know this stuff, who do
Mm-hmm.
these things, and I'm just like, man, you guys are great. And when I come across techs who have never, I've never reported, I don't want to get in trouble. I don't know if I
Mm-hmm.
want to go to court. They're nervous. They don't understand the process. They've never been talked to about this. Maybe their vet doesn't know. They've never done any of this before. It's about not just fostering that relationship, but helping each other be guides in your respective fields and
Mm-hmm.
building that trust. Is that
Right.
we're in this together. We can help each other do these. It's so critically important. If you see that relationship and how these cases go when you have that rapport with each
Mm-hmm.
other. A couple of weeks ago, we had a Jessica Rock, she's a prosecutor on,
Oh
and we
yeah.
were just talking about like, take them to lunch, like go and do something together, talk, chat while you're there, form those relationships
Mm-hmm.
because you're going to need them. And it's just, I think it's so critical.
Well, you're also dealing with subject matter that can be, as we know, as simple as just, again, simple neglect. Maybe the owner didn't know, bad flea infestation. We're going to do better next time. To
Mhm.
horrendous stuff. It's a plethora of things that you will see. So you kind of have that camaraderie and understanding, and have that network that supports you. Hey Ray, I had this case today. I'm coming to you. It really hit me because it looked like my dog, or it just was so traumatic. And it's like you're around like-minded people that you built these relationships that are going to help you get through it too, because it's not always easy
Mhm.
to see this stuff day in and day out and know that you've tried to do your best, but sometimes you're not able to get the results that you want. But be proud of yourself for taking the initiative and trying, and you have somebody else there that says, hey, you know what, you did the right thing, we'll get through this. You don't have that and you're doing it by yourself all the time, you're going to get burnt out even quicker, and you're going to start doubting yourself and whether you should be doing this. You got to have that tribe, that
Mhm.
village,
Yeah.
and yeah, building those relationships. I mean, doing this with you guys today, it's awesome. Now meeting you, seeing the work that you and Jacob are doing, it gives me a learning outlet, and it also gives me a network of when I am hopefully eventually in the field full time, I have these people like yourselves that are knowledgeable in these areas, and I can say, hey, I don't really understand this wording of this law in Utah, and what do you think, Ray? Can you help me
Mhm.
understand this better?
And vice
We
versa. And I'll be
Yeah.
like, I don't know, what, say, can you explain what a luxating patella is? It's like you don't have to know everything. We got to work together
Yeah.
to get the outcome that we want, that's best in the end. What is best for that animal?
Yeah, and looking at the team that we have to prepare to advocate better for these animal victims. You know, one of my professors from UF, you know, I had a chat with him, and you know, I was kind of feeling down because I was kind of having that imposter syndrome a little bit, and you know, I'm like, you know, just a tech, and he's like, no, you are a vital part of the forensic team. It's
Mm-hmm.
just not always put out there, as you said. You know, when you look at a lot of the training, law enforcement, ACO, lawyers, veterinarians, you know, where's the
Mm-hmm.
technician?
Right.
In the forensic world for humans, you have those techs that set up the autopsy, you know, assist with autopsy. We need that for necropsy.
Mm-hmm.
If I have a DVM that's going out on crime scene, wouldn't she love having a technician that knows how to, you know, facilitate around a crime scene, get samples, get chain of custody going, assist with necropsy, you know, be able to get animals needing triage, live animals. It all goes together, and that's been the biggest complaint, even in program. You know, I'm in class, and it's from a veterinarian standpoint. Well, I'm not a veterinarian. I can't do these things because it's out of my scope. So I need to come from a technician's point of view and give you this. And I don't want to say anyone's doing a bad job. I just, you know, even CEs for some of these things. I mean, a lot of the big medical conferences don't cover this, you
Mm-hmm.
know, so I
Yeah.
still have to keep my CEs up and get that stuff in for my license. But I'd like to be able to get more CEs based on the things that I want to study. I did sign up. There's a ASPCA dogfighting workshop, and I'll be going to North Carolina for that. And it's free, and I'm excited about it. But on the flyer, veterinarians, and I had to ask them, I'm like, are these CEs that I can use for my tech license?
Right.
And so I would like to see the field and these programs and the education that's getting out there. I love it. I think it needs to be directed to the people they are, but I would like to see technicians included in that a little bit more, because I think we are a vital role that's needed in this field, and I don't think it's been really looked at.
Yeah.
Or I know it's a newer field. Well, it's an old field, but coming to light. But I really would like to see, and that's kind of what I'm hoping to do with podcasts like with you guys, and when I talk to people. I mean, every time I say, you know, veterinary forensic, everybody just goes, you know, what is that for, you know, like dogs fighting dogs, and I'm like, no, the victim is the dog. It's like, and I hate to use the term human CSI, because as I learned in school,
Mm-hmm.
the CSI effect can really skew, you know, cases and things like that, and the mindset that everything gets done in an hour because there's no
Right.
commercial breaks. And yeah, so I
Yeah,
hate,
that'd be great.
I know, right? The analysis is done in 15 seconds, and I already know who's done it. But I hate to use that, but you almost have to, because otherwise people don't get it. And I'm like human CSI, but we do it for the animal victims. So anything that happens to a human can happen to an animal, and they become the victim. And that victim needs to be advocated and testified in court for. And the perpetrator and I go into it, and they kind of get it, but it's even in tech forums, they're like, oh my gosh, I didn't even know this was a field. And I'm
Mhm.
like, yeah, it really is. And you know, so it's crazy to see that it's become what it is, and thank goodness it is, because it's going to be a field that's needed. As
Yeah.
long as we have scrupulous and mean and evil people that hurt animals and continue on to humans, we're always going to have a job. But I
Right.
just really feel like we need to look at the team and not solely focus on just these avenues, and start really looking, how do we make this the best forensic animal advocate team to advocate for these victims? You know, how can we put
Okay.
our best people out there in court testifying? Um, and that
Because you think
means,
in those cases, like you guys are basically the first ones on the
mhm,
scene. You know, you're the first
mhm,
people who bring the dog or the cat in, who
mhm,
examine them, who interview the owner or the
mhm,
caretaker, whoever's bringing. You are the first ones involved, even before vets, right? In
yeah,
those
yeah,
cases, when people are bringing them in for treatment and whatnot. And even if that doesn't happen, and say there's cruelty or whatever in the field, that we seize the animal and bring them in, I'm coming and I'm asking you a million questions. What's wrong? What is the injury? How is it sustained? What does it look like? what is the treatment for this, what is their pain level, all of these
Hmm.
things that just having done this and had that experience I could probably say, but because I don't have the licensure for it, I'm
Right.
relying on you guys and your
Mhm.
experience, because there's a good chance you're going to be subpoenaed to appear in court for that too.
And human nurses, they're given the education on neglect and potential abuse. I believe they can or have to report or
Mhm.
at least disclose it. There's no reason why we are that. I know I'm not supposed to use the word nurse because it's copyright and all that, but we are the equivalent. I am the equivalent of a human nurse, and
Mhm.
I take history. And like you said, I've before the vet has seen that pet or the client, I've already spent at least 15 to 20 minutes, if not. I've already been in the chart prior to going in to see if there's anything. Let's set aside the abuse neglect. Let's look at the chart and see if there's any, medications that we can't use. Is the dog, a need to go slow because they might be a little bit fractious? Have we had any problems with the owners in the past being verbally? So we've already been in the chart. We're now conversing and interviewing and getting history. We've seen the dog. We've probably seen the dog or the cat or the animal and client out in the waiting room. So by the time I go and convey my notes and put my soap and stuff in for my vet, I know a lot that's going on. Why don't we put more into that? Now,
Right.
again, you got to have
It's
the
like you've done
education.
that. It's almost like you've done that and now you're done. Push the tech
Hmm.
to the side. Okay, thanks. Have a nice day. And it's just, that bothers me because the role that you guys play, your importance in the lives of animals, whether it's a cruelty case or not, and your importance and necessity in our cases is, I mean, it starts with you guys. We rely on you guys so much. Our disciplines are so very different, but they're
Hmm.
so closely ingrained
Right.
when it comes to
Hmm.
these cases. And, I feel bad that all these conferences and trainings and such I go to, it's always the vet, the vet, the vet, the vet.
Hmm.
And it's never about the tech, maybe here or there. And I think that we should change that. Maybe we should chat about that a little bit more. Maybe we should do something with AWIP and training for techs. I'll talk about that.
I like that.
Now I'm thinking about it. I think that might be a good idea. All right, we'll
Yeah.
we'll work on this, Renee.
I love it. I love it. Because, I mean, people are getting animals more and more. People are starting to, thank goodness, change the mindset that they're not just property, that they are family members. So if we think about, I think there was a study a couple of years ago with it broke down each type of animal and how many people in the United States own them. Anything from a bird to a dog, dogs and cats, obviously, and horses were really up there. With all these people having more and more animals in their care, the chances for more, for us to see more cases.
Hmm.
And with COVID, societal issues, the societal stress, I know domestic violence went up in the state of Texas during COVID. I read something about that. The bullying, I mean, just societal issues. That's going to push, and people owning animals, more people owning animals. It's a no-brainer. Those things are going to rise. These cases are going to rise, and we've got to have the manpower and the properly educated and skilled manpower get these to the right place, because it does no good for you guys to take something and try to prosecute it and take it to law if you're not getting the right evidence, you're not
Right.
getting the right documentation, you're not getting the right handling, because your
Mhm.
hands are tied. If you Well, I sent you photos, you sent me 3 photos and I can't see anything in it, but then you're the bad guy.
I remember a case I had years ago at the point when I didn't really know anything about avians. And I had a tech who worked at my shelter. She used to work at a parrot rescue. And I brought her with. I wrote her in on my warrant and I brought her with. And I just told her, I can tell you what a scarlet macaw and an African gray are, but like, I don't know nutrition. I don't know this stuff. This
Mhm.
was a couple years ago. And I brought her with into the house, into this hoarding house, and she went with me, held my hand. This is this kind of bird. This one looks bad. This one's, sitting on
Wow.
the bottom of the cage, and that's not normal. And I learned so much from this tech. It was amazing. It was in her involvement, her expertise in that really helped me, helped the case, helped the animals that we ended up taking. I mean, it was, I can I the more that we talk about this, the more examples I can think of where I'm like, this
Mm-hmm.
didn't help, and this I wouldn't have been able to do it without this one, and your role is so vital. So Renay, before we wrap up here, is there anything that we didn't cover? Is there anything that you want to say specifically to our viewers, whether they're techs or not, about what the future of this looks like, or just anything having to do with vet techs?
I think it's a array of, if it's something you want to do, and you're struggling for the people that are in the veterinary medical field as assistants or technicians, go for it. Do it for you. Do it for your betterment of your job, your profession, your self-worth, your self-confidence, because you're going to be better. You're going to be able to bring more to the field. Don't limit yourself and just do what has always been done, because there's fields like this. There's fields where you can even go beyond the scope of just a hospital setting. And for the vets out there, the law enforcement, ACOs, humane law, prosecutors, give us a chance. Give us a chance and utilize us, and not just in the animal welfare and forensics field, but open your mind to these green technicians just coming out of school. Not everybody came out of school. You as a vet, prosecutor, when you first started, you had to come from somewhere. Embrace and teach those that want to learn and become better. Open those doors for communications. Talk to these guys and gals coming out of tech school and see what their passion is, where they have something. You may have a behavior, gold medal winner, and utilize that person, support that person. Stop letting the egos keep you from being a better professional in your field, and look at the big picture. And ultimately, that is about our clients, our pets, our patients, and public health, because it's not an animal versus human thing anymore. Regardless, we need the humans involved to take care of the animals. Embrace your fellow technicians, love them, support them, and let's do better for the main goal, and that's every animal that we can help.
Well, thanks, Renay. I think you put that pretty well. I
Thank you.
appreciate you coming on the show. I think it was really, really important for Jacob and I to have you on, because we really wanted to highlight your work, what you do, the importance of technicians, regardless of their background, training, experience, and just the vital role that you guys play in our lives and the lives of animals and people. Just thank you again for coming on. I really appreciate it. And thank you very much to our listeners who tune in every week and listen to this. And if there's any techs out there, this one's for you. Feel free to reach out to me or Jacob at any point in time. We're on LinkedIn. It's probably the easiest way to get a hold of us. Our episodes air every Tuesday, and we'll post them up on LinkedIn, YouTube, and Spotify. And thank you again, Renay. And
Thank
thanks to
you.
our listeners for tuning in to the AWIP podcast. And we'll see you next week.